Welcome back to our every Friday at noon edition of Women's Health Weekly. We have an all-star team today, fantastic opportunities to answer all of your questions. So I want to get started here. I want to jump right into it. We have a great question from one of our YouTube viewers. Don't we need sunlight for vitamin D production? And knowing that, does sunscreen block the level of the natural sunlight benefit for vitamin D production?
You do get a certain percentage of vitamin D from the sun. You only need about 10 to 20 minutes outside. The UVB light that gets onto your skin can make vitamin D. It's kind of weighing the balance, I think, especially now there's a lot of talk about vitamin D and the coronavirus and your immune system. So I think it depends on what time of day you choose to go outside, what you're prone to sunburn is. And also there are a lot of supplements now that you can take for vitamin D. So, if you're out for 10, 20 minutes to get your vitamin D, that I get that. You only need that amount of time. But if you're out for 3-4 hours, you got well more vitamin D than you needed that day, specifically from the sun, but you got a lot more sun damage in those extra, 3.5 hours.
I have a great question from one of our YouTube viewers. You know what else is really common that we see all the time that Dr. Glick, I bet you see all the time, and I know Dr. Ostrov and I see this all the time because it's so incredibly common, are thyroid problems. Problems with the thyroid and low levels of thyroid hormone. The question is, can thyroid issues cause eczema?
Not exactly eczema, I would say, but I would say dry skin for sure. Hypothyroidism has one of the primary symptoms or signs of hypothyroidism, which is an underactive thyroid, would be dry skin. I wouldn't say, just because you have dry skin, you have to worry that you have hypothyroidism, because it's definitely not the most common cause. But I would say one of the most common labs that I run in my office is a TSH to check for people's thyroid for sure. We have what's called generalized pruritus or generalized itching. So if someone comes in with just diffusely dry skin and itchy skin, one of the tests that we run is for sure to check their thyroid.
One of our YouTube viewers asked a great question. She asked the question that these at-home devices are becoming more common, and wants to know and knows that it's advised not to use them on moles or freckles, but also noted that there aren't really great specific instructions about how to work around moles and freckles, or even how to use maybe even how to use the devices. So can it be used right next to a mole? What would be the consequences? And do you have any advice about that with regard to home IPL devices?
The difference between the two is that a laser is one wavelength of light, and intense pulse light would be multiple wavelengths in one. Intense pulse light can be used based on the wavelength that you set it at, to treat red spots, to treat brown spots, and also to do laser hair removal. So, the fear is that if we laser a mole, which typically moles have melanin in them, right, which is the target of these lights and lasers, that you could potentially discolor it, alter its features, and in a worst case scenario, morph it into becoming a skin cancer. I think that a lot of that is theoretical. I think that, we try our best in the office, and at home, I would try your best to avoid the mole, but I think that's the primary reason why they want you to stay clear, because those often have a lot of melanin too, that you might end up burning yourself, because the more melanin in the area, the more the laser sees and the more intense the laser reaction. So if you have an area where you have a very large mole, that laser can tend to see that and burn it. So I would just say being as careful as you can be.
I have one last question that kind of wraps up a lot of the conversation we've been having. Comes from Deborah, one of our YouTube viewers. What is a good moisturizer, diet, and vitamins for aging dry skin?
If you have dry skin, you want to take 5 to 10 minute showers with lukewarm, coolish water. You don't want to use any scrubs or rubs, anything that can inflame your skin. That will only worsen your skin barrier. My two favorite moisturizers that I would use, that I do use myself, would be CeraVe. Comes in a nice little white jar, CeraVe cream. or amlactin rapid repair. Both of them have ceramides in them. Amlactin also has something called lactic acid in it. Is a alpha hydroxy acid that helps to hydrate the skin as well. Um, in terms of supplements, I think that there's a lot of the things out there. I don't know of anything specific that can help specifically with dry skin. There's a lot of controversy on like fish oils and whether or not they're good for your heart, they're not good for your heart, and taking that. I myself take vitamin C and vitamin D every day, especially during this time. I think that making sure your vitamin D level is in the normal range is helpful to your immune health and also to your skin health.
If you missed some of the earlier conversation, please go back. Our video will be posted on our YouTube channel. That's youtube.com/maidenlanemedical. Once again, everybody, thank you so much for joining us. Thank you for another wonderful Friday conversation and really fantastic questions. Most especially, thank you to Dr. Jaimie Glick. I hope everybody has a pleasant, safe, and healthy weekend. Once again, thank you very much.